I'm Dr. Bill Rodriguez with FIND. We're based in Geneva, Switzerland. So India is an important country in the global fight against HIV just because of the size of the population, but also the strength of the program over time and how much it's grown. Right now, the guidelines from the WHO for HIV is to reach a 90-90-90 threshold. And what that means is we want 90% of all people who are HIV infected to know that they're infected, to have a diagnosis. Then of those, we want 90% of those to begin treatment. And of those, we want 90% to be successfully treated with undetectable virus. And so India's done a good job of getting to a threshold of, I think, about 50% of patients that are now aware of their diagnosis. But they need to hit that 90% threshold. And that will begin to show the world that a country the size of India, with the resources of India, can turn the tide in the HIV epidemic. And that's really the target of this 90-90-90 program. The second thing that I think is important for India with respect to HIV is to integrate services. We've been focused on HIV as a disease. And really the goal shouldn't be the disease, but the patients. And patients don't come in with HIV, they come in with whatever they have, including other diseases, mental health issues, tuberculosis, hepatitis C. We need to begin to provide primary care and integrated services. And the Indian health system is set up to support that and to demonstrate that that's possible. And that will be, I think, an important target for India to reach in the near term. So right now, hepatitis C, the biggest challenge is not in treatment. It used to be in treatment, but the biggest challenge in hepatitis C is the lack of an accessible diagnostic test. And so what's needed there is something as simple as a finger prick test that would then be able to give a diagnosis of hepatitis C in 15 to 20 minutes. And we're not there yet. That's going to require new technologies and innovation, but they are right around the corner. We're probably 2 or 3 years away from such a test where we could diagnose someone quickly and expand screening tests nationwide in India and really worldwide. There are a number of companies, including companies in India, that are poised to make that breakthrough, and we expect to be validating those tests through programs at FIND sometime in 2017, 2018. And that should enable widespread screening and treatment to begin shortly thereafter. Pediatric disease, it's really important for FIND to be involved because children aren't able to advocate for themselves. So we think we have a critical role to play there. There are a number of diseases that children get sick from and die from and are major causes of death around the world. Malaria is probably the largest and most important. So we have an active program to develop and validate malaria rapid tests that are able to diagnose children with malaria within 15 minutes and start them immediately on treatment. And that's a large project that's been ongoing at FIND for about 10 years. The other thing that children present with is generalized fever. Children will show up with a fever and you don't know, are they very sick, are they not sick, do they need an antibiotic, do they not need an antibiotic? And that really amounts to a point-of-care diagnostic test. So we're involved with a number of companies that have new technologies and new markers of fever to help clinicians identify, does this child in front of me who looks sick need to be started on therapy immediately, or do they have a benign illness that doesn't need antibiotics or antimicrobials? And that's an important new program for FIND. And then the third area that's really important to us is in pediatric tuberculosis, which is a global challenge that's been overlooked in many ways. So probably the most difficult thing about pediatric tuberculosis is that the infection, even though it causes children to be sick, doesn't display a lot of signs. So we can't use the standard diagnostic tests, which generally involve collecting sputum from a patient who's sick and then looking for tuberculosis in that sputum sample under the microscope or in another laboratory test. Children just simply don't show that kind of response. So what we need is a test that's either able to use a different sample from a child or is so sensitive that we can find the rare tuberculosis bacteria that are present. So we've worked over the past few years with a number of companies, especially Cepheid, to develop a technology that's really geared specifically toward identifying the low levels of tuberculosis that are present in children. And that's a project that's now rolling out broadly. Specifically in India, we've been engaged in a project for a few years now where we've rolled out pediatric testing broadly in 4 cities in India. And that testing includes diagnosing tuberculosis and also identifying whether children are infected with drug-resistant tuberculosis, which is a critical distinction to make, otherwise you'll start children on the wrong therapy. And what we've found is that we've been able to find very high rates of tuberculosis in those cities and extremely high rates of pediatric tuberculosis. So we've identified those children and immediately linked them to therapy and made sure that they completed treatment courses. That project has gone so well that the Indian government and USAID, which is funding this, has decided to expand it from 4 cities in India to 9 cities. And so we expect it to play a critical role in helping turn the tide of pediatric tuberculosis here in India. So hepatitis C is one of the diseases where the links between testing and treatment are critical. And to date, we've been focused as an organization on the need to improve testing with better, simpler diagnostic tests. Pharmaceutical companies have been focused on new drugs that are curative, and the new drugs are extremely impressive. You can cure someone of this disease in 12 weeks with just 1 pill a day. What we found to be critical is to make sure that those 2 activities are linked, that people who are getting screened and tested are immediately started on treatment, and it's a paradigm that we refer to as test and treat. And the ideal way to do that is to link diagnostic organizations with drug companies and pharmaceutical companies. So Cipla is one of the leaders in HCV treatment, or rapidly becoming them, with new drugs that are now widely available in India and soon elsewhere. So our goal with the partnership between FIND and Cipla is to integrate programs by showing through demonstration projects at various sites in India in partnership with NGOs that take care of HIV patients or people who inject drugs, to demonstrate that we can screen those populations, identify the people who are HCV infected and start them on drugs provided by Cipla, and demonstrate that that can be an efficient, cost-effective, and very effective, from a health perspective, program. And so we expect to roll out those projects later this year, and over the next 3 years really demonstrate that India can scale up treatment using Cipla's drugs and tests that FIND helps develop to reach all of the 12 million people in India who are HCV infected.